The first cases of bovine spongiform encephalopathy occurred in 1985 in Great Britain. The disease was subsequently diagnosed in other, mostly European countries, but with a much lower incidence. The cause of the disease was found to be an agent in feed that was derived from rendered animals. Based on recent studies, vertical transmission of BSE from dam to offspring is also possible. In order to eradicate this disease as quickly as possible, it is important that animals with suspected BSE be identified and euthanized along with their offspring. The clinical examination plays an important role in the identification of suspected cases. This video demonstrates the procedures used at the Clinic of Ruminant and Equine Medicine at the University of Zurich for the clinical examination of cattle suspected of having BSE. First, the occurrence of behavioral changes is determined from the history and by careful observation of the animal. Then, disturbances in sensitivity are determined by assessing the animal's reaction to touch, sound, and light. Finally, locomotion is evaluated while the animal is being led and while it is moving freely. This film is composed of videotapes of 50 cows with BSE. Let's begin with the assessment of disturbances in behavior. This is a healthy cow standing in the examination room at the clinic. The cow stands quietly and is not greatly affected by the unfamiliar surroundings. In contrast, cows with BSE are often very nervous under the same circumstances. The number in the lower right corner is the animal's identification. Cows with BSE are often very alert and excitable, which may manifest as a sudden jerking of the entire body. Most cows are also feelful. Disturbances in behavior, such as fearfulness and nervousness, are more clearly pronounced when the animal is excited. Other possible symptoms are increased salivation, a frightened look, or a bug-eyed appearance. Sometimes the animal will grind its teeth. Other symptoms include frequent licking of the muzzle and wrinkling of the nose. Often, muscle fasciculations can be observed, as is evident in this cow in the shoulder region. Some cows also exhibit nervous ear movements. In the terminal stages of BSE, the animal has difficulty getting up, or it may remain recumbent. Note the frightened look in the eyes of this cow. After getting up, the cow looks anxiously around. She is easily excited. This is apparent by an immediate jerking movement of the entire body when something unexpected occurs. The cow has muscle fasciculations in the shoulder region, but also in the hind limbs. She inspects her surroundings with increased alertness and anxiety. Her bug-eyed appearance becomes apparent when she stares at the ceiling. Also, the cow's head is trembling slightly, but clearly noticeably, and she licks her muzzle. Besides changes in behavior, animals with BSE commonly display disturbances in sensitivity. They may be hypersensitive to touch, to sound, or to light. However, an affected animal will not usually be hypersensitive to all three types of stimuli at the same time. The most common disturbance is hypersensitivity to touch, which occurs in almost all cows with BSE. This healthy cow will serve to demonstrate the procedures used to assess disturbances in sensitivity. We approach the animal quietly from the side and assess sensitivity by touching the neck and head with the hand. A healthy cow usually tolerates these manipulations. Then we use the tip of a pen to touch the skin over the entire head and the neck, which often elicits a strong defensive reaction in a cow with BSE. Sensitivity is further assessed in the shoulder region, over the lateral thorax and the back, and along the lumbar and gluteal regions. A healthy cow remains calm during the examination. Sensitivity can be assessed in the hind limb area by use of a broom. This so-called broom test involves touching the cow's hind limbs distal to the hocks with a broom and the assessment of her reaction. The reaction to different stimuli in cows with BSE varies. This animal tolerates being touched by hand in the neck area. However, she is markedly hypersensitive when touched with a pen, particularly on the neck. This is evidenced by her evasive movements and head shaking. Her reaction in the shoulder region is less pronounced. The next cow tolerates manipulation of both the neck and the head. However, she reacts defensively when touched with a pen in the chest, shoulder, and neck regions. Cows with BSE are less sensitive to manipulation of the caudal areas of the body compared to the cranial regions. In this cow, we start to assess sensitivity in the gluteal and lumbar areas, after which we proceed cranially. This cow is mildly hypersensitive in the lateral thorax. She reacts to manipulation in the shoulder region by evasive movements, head shaking, and wrinkling of the nose. Hypersensitivity is most pronounced in the neck and head regions. In severely hypersensitive cows, it is advantageous to begin the assessment in the caudal regions. This cow shakes her head vigorously, salivates, snorts, and, in her excitement, even loses her footing. Cows that are hypersensitive in the hind limbs will kick, sometimes violently, when touched with a broom. Some cows with BSE are hypersensitive to sound. The methods used to assess sensitivity to sound at our clinic will be demonstrated on a healthy cow. The examiner taps a metal container to generate sound. A healthy cow perceives the sound, but doesn't show much of a reaction. In cows with BSE, there may be a mild reaction consisting of restlessness and pulling away. A frequent reaction is jerking suddenly with every sound. The degree of reaction varies among affected cows. Hypersensitivity to sound may also manifest as changes in behavior, such as trembling of the head, a frightened look, and salivation. Cows with BSE may also be hypersensitive to light. The assessment of sensitivity to light will be first demonstrated on a healthy cow. The room is darkened. Only the silhouette of the cow can be seen. Then a bright light is directed toward the cow and her reaction is noted. This procedure is repeated several times. This healthy cow looks around but has no reaction to the light. This cow with BSE is hypersensitive to the light. She reacts by jerking suddenly and has muscle fasciculations in the shoulder area. The next animal reacts similarly. It also is startled and looks around nervously. Another cow is severely hypersensitive to light and jerks suddenly. Finally, let's observe this animal in the barn. When the light is turned on, it becomes very excited and attempts to free itself. BSE is also characterized by disturbances in locomotion. First, let's watch a healthy cow that moves with an even gait and does not hesitate to step over the small gap between the weigh scale and the ground. Cows with BSE may have abnormal locomotion of varying severity. This cow with BSE has a mildly disturbed locomotion. She walks slightly stiffly, makes a small jump, and sways slightly in the hind end. Another cow has a more pronounced disturbance in locomotion, characterized by swaying. She stops in front of the gap near the weigh scale, starts to shake, and finally tries to avoid the gap. During the next attempt, she jumps over the gap with one leap. Another cow has severe hypermetria in the hind limbs, with a high stepping action resembling that seen in stringhalt in horses. Here we see a cow with hypermetria in the hind limbs and mild ataxia. Disturbances in locomotion often are more apparent when the animal moves freely. This cow has severe generalized ataxia. She sways, staggers, and collapses in the hind end. This cow also has generalized ataxia that becomes more pronounced when she turns, at which point she begins to stagger. Finally, let's look at the disturbances in behavior, sensitivity, and locomotion in a cow with advanced BSE. This 6-year-old Swiss brown fee cow is panicky and has muscle fasciculations in the shoulder region. She appears frightened and is restless. The cow is severely hypersensitive to manipulation on the cranial neck and head regions. She shakes her head, shows phlegm, and salivates. She also licks her muzzle. Her reactions become more pronounced when touched with a pen. She is only mildly hypersensitive when her hind limbs are touched with a broom. The sound test causes her to pull away. Her increased excitement results in muscle fasciculations and marked salivation. She does not react to light. While being led, she jumps over the gap at the weigh scale. The cow has generalized ataxia when moving freely. She loses her balance and falls down. Then she has difficulty in getting up. Obviously excited, she moves her ears nervously and swishes her tail. Most cows with BSE have disturbances in behavior, sensitivity, and locomotion. However, because the symptoms vary among individuals, it is important to perform a thorough clinical examination on cows with suspected BSE. Careful assessment of behavior, sensitivity, and locomotion is at the present time the most reliable method of diagnosing BSE in the live animal.